This video is about medical terminology and body cavities. For starters, I will start off with the body cavities. And bear with me, this pen is not open, so I will not be drawing on your figure, Mr. Quick. Okay, let's start. Alright, you have within the thoracic cavity and the abdominal pelvic cavity, which separates into the abdominal and pelvic cavity. Within the thoracic, you have the mediastinum, which is above or superior to the pericardial, and then on both sides you have the plurals, and then within the abdominal pelvic cavity, from top to bottom, you have the right hypochondriac, right lumbar, right iliac, and then in the middle you have from top to bottom the epigastric, umbilical, then hypogastric, and then on the left side from top to bottom you have the left hypochondriac, left lumbar, left iliac. And then for the remaining two cavities, they are on the dorsal side, which are the cranial and the vertebral. Okay. Now moving on to medical terminology. Starting off with the cephalic, that contains the frontal, the orbitals, the nasal, the buccal, the oral, and the mental. And then inferior to that is the cervical. Inferior to the cervical is the thoracic, which contains the sternal and the mammary. Then within the brachial, you have the acromial, you have the carpal, the antebrachial, the antecubital, and also you have the palmar and the pollex, which is your thumb right here. Then within your crural right here, you have your femoral, your patellar, and then your plantar, the base, the sole of your foot, and you have the popliteal, the sural, and the hallux, which is your big toe, and also your tarsal right here. Then within the dorsal side, you have the dorsum, the sacral between the hips, and then the lumbar. Then you have the scapular, the occipital. Then you have the axillary, then the vertebral, and not to forget your digitals, which are your fingers and toes. And then last to mention, the calcaneal. This video will be about directional terms. This is mid-sagittal, this is parasagittal, this is a transversal, and those are all cuts that are done. And then the midline is directly down the middle of your body, and then moving away from that is horizontally is lateral. And then point of origin, also known as your proximal, is a starting point, and then moving away from this in any direction is called distal. And then between medial and lateral is the intermediate, going this way. And then going upwards is superior, downwards is inferior. Then a cut that is superficial is just scratches along the body, and then a deep cut is something that goes beneath the surface of the skin. And then this is your anterior side, and then this is your posterior or dorsal side. And then once again, this is your medial, your midline, just straight down the middle. Yeah, thank you.